And today I'm going to detail how bacterial biofilms contribute to atherosclerosis and heart attacks. Biofilms are complex, gelatinous protective structures created by microorganisms that help them adhere to intestinal walls and crevices. Many species of bacteria form biofilms as a response to antibiotics, and this biofilm generation is one reason why antibiotics are increasingly becoming less effective. But biofilms are definitely not limited to the gut, as they can form on nearly any body surface that has moisture. And one of the most prevalent biofilm generators is also one of the most common bacteria found in the body. It's known as Viridin streptococci, and you normally find it in the oral cavity, upper respiratory tract, and the gastrointestinal tract. And while it's generally harmless in these locations, it's also an opportunistic pathogen that can cause a serious infection if it enters the bloodstream.
Viridin streptococci is a major component of arguably the most recognizable biofilm, dental plaque, and poor dental hygiene, gum disease, and even routine dental procedures can all usher this common bacteria into the bloodstream. Viridin streptococci then circulates in the blood until it finds a susceptible site, like a damaged arterial wall or compromised heart valve, and this is where we find plaque accumulating in response to the damage. Arterial plaque is primarily comprised of lipids, oxidized cholesterol, excess calcium, and decaying waste material from dead cells. And the gradual accumulation of this arterial plaque and the inflammation and arterial calcification that accompanies it is known as atherosclerosis. Fibrin, the sticky blood protein that is the primary structural component of blood clots, is also found in arterial plaque, and Viridin streptococci can adhere to fibrin aggregates, and this is where they produce their protective biofilm, which then allows them to evade detection and destruction by immune cells like macrophages.
The biofilm can remain dormant within the plaque's necrotic core, causing undetected chronic inflammation until events like a viral infection, acute stress, or even insufficient oxygenation, known as hypoxia, can cause the dispersal of bacterial colonies from the biofilm. The released bacteria then trigger a massive immune response that involves cytokines and matrix metalloproteinases, which degrade the plaque structure, increasing the likelihood of rupture, leading to a blood clot on the surface, which then can completely block blood flow to the artery, which is the most common cause of heart attacks.
Obviously, avoiding this deadly cascade begins with maintaining optimal oral health on a daily basis, but there are also numerous easily available natural biofilm disruptors and other supportive nutrients that you can take every day. And some of the best include the glutathione precursor N-acetylcysteine, or NAC, which can dissolve the disulfide bonds and other cross-linked gel components critical to the biofilm's structural integrity. The proteolytic enzymes serrapeptase, nattokinase, and lumbrokinase, when taken on an empty stomach, can directly break down the excessive fibrin that otherwise reinforces the arterial plaque structure, and again is where bacteria adhere to and generate the biofilm. And in addition to these direct biofilm disruptors, some vitamin K2, as menaquinone 7 or MK7, helps by preventing calcium accumulation in the blood vessels, while trimethylglycine, or TMG, and also a daily B vitamin complex neutralize excessive homocysteine, which is a well-known contributor to atherosclerosis, along with some additional flushing niacin, or vitamin B3, which optimizes the removal of excess cholesterol from the arterial wall and its transport back to the liver for proper excretion, a process known specifically as reverse cholesterol transport. All of these can help to reduce further arterial plaque deposition and related inflammation.
I hope this gives you a new perspective on the pathogenesis of heart attacks, relevant to bacterial invasion in the bloodstream, and particularly how bacterial biofilms can accelerate this process. The strategies I've given you for dealing with this are very practical and easily accessible things you can do every day. And you should, because atherosclerosis is a silent, slow, and progressive condition that often shows little to no symptoms until a heart attack or stroke occurs.
Thanks for watching. I'm Jason Carter, and I'll see you next time on ENZYMENTAL. Stay healthy.